Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's discussion is screening for colon cancer. Colon cancer is a huge problem in the United States. Colon cancer is the second most common cancer affecting men and women and is the third leading cause of cancer death. Now, colon cancer is a very slow-growing type of cancer, so early detection can lead to better treatment and possible cure. Now let's start by defining exactly what the colon is. The colon is also referred to as the large intestine, and it starts in the lower right portion of the abdomen and is shaped like an upside-down horseshoe. The colon or large intestine starts by the appendix. It then moves up, over, and down the abdomen, with sharp corners or sharp turns being made in the right upper portion of the abdomen and also the left upper portion of the abdomen. As the colon goes down, it moves towards the midline and exits the body through the rectum. When we talk about colon cancer, we often link colon cancer with rectal cancer and call it all one thing, colorectal cancer. Now, there's several different types of cancer that a person can get in their colon. The most common type of cancer starts in the lining of the large intestine, and we call this carcinoma. Less common forms of colon cancer would include carcinoid cancer, melanoma. Yes, you can get a form of melanoma in your intestine, lymphoma, as well as others. But by far, the most common type of cancer is the carcinoma. Now, carcinoma typically starts with a polyp. A polyp is a small outgrowth from the lining of your colon. Over time being many, many years, this polyp can turn cancerous. The cancer can start to invade the intestinal wall, and in the worst case scenario, the cancer leaves the intestine and metastasizes or moves to other organs. The liver is the most common organ for colon cancer to metastasize to. Unfortunately, polyps in early colon cancer have absolutely no symptoms, so it's very hard to detect, which is a shame, because if colon cancer is found in its earliest stages, it can be completely removed and the patient is completely cured of the disease. Most experts would agree the time to start screening for colon cancer for the general population is at the age of 50. Now, if you have high risk factors, such as a family member with a history of colon cancer or inflammatory bowel disease, which would be Crohn's disease or ulcerative colitis, then you should probably have your screening done a little bit earlier. But for those of us in the general population that don't have those risk factors, age 50 for both men and women is the time to start thinking about screening for colon cancer. Now, we talked about polyps and how they develop into colon cancer. One property of polyps is they have a tendency to bleed a little bit. The blood produced is not enough to be seen with the naked eye. So you may not see the blood after you have a bowel movement. You may not see any blood on the toilet paper, but blood can still be there. There's a nice test that can be done called the FIT test, F-I-T test, where you obtain a small sample of your stool after a bowel movement and bring it into your doctor or send it to the lab. The stool can be tested for blood, what we call occult blood. And what we mean by occult blood is blood that can't be seen by the naked eye. If you have blood in your stool, that means that a different test has to be done to evaluate you for possible colon cancer or polyps. Now let's talk about the more invasive tests that are available. The first is the sigmoidoscopy. Now, a sigmoidoscopy uses a flexible, lighted scope with a camera that goes up into your intestine and looks for polyps or other abnormalities. The sigmoidoscopy can often be performed in a doctor's office, and the preparation for this test involves using a Fleet's enema. Sedation for the sigmoidoscopy is usually not given, and if it is given, it's usually a very light type of sedation. The patient lies on his left side, and the scope is passed up through the rectum and examines the lower portion of the large intestine or the colon. The sigmoidoscopy does not look at the entire colon. If done for colon cancer screening, A sigmoidoscopy needs to be repeated every 5 years, assuming that it was normal. In addition to the sigmoidoscopy every 5 years, it is important to have that FIT test looking at the stool for occult blood every year, even though you've had the sigmoidoscopy. The gold standard cancer screening test is the colonoscopy, and this is the one that everybody always talks about. With the colonoscopy, you need to have a complete bowel prep. In other words, your entire intestine, from the small intestine to the large intestine, is cleaned out. There's a couple different ways of doing this, but oftentimes patients end up drinking a gallon of a bowel prep solution. Now this is done a day following a bland liquid diet, so the entire prep from start to finish can take over a day to complete. With a colonoscopy, you actually end up going to an endoscopy center or an endoscopy suite. An IV is started in your arm, and IV sedation is administered. Oftentimes, patients have oxygen put on also. You're not completely knocked out like you would be during surgery, but most patients don't really remember much from their colonoscopy due to that IV sedation. Now, here's the big advantage of a colonoscopy. Your entire colon is examined, from the rectum all the way over to the appendix. If any polyps are seen, they're removed. The biggest plus of a colonoscopy is, if nothing is found, if they don't find any polyps or any other abnormalities, you are off the hook for 10 years when it comes to colon cancer screening. You don't need to do a FIT test, you don't need to do a sigmoidoscopy, you are set for an entire decade. Now, some patients are curious about the virtual colonoscopy, since it seems to be less invasive, although it is in many cases more expensive. With a virtual colonoscopy, you have to undergo the entire bowel prep just like you did for the regular colonoscopy. This is done at a radiology center though. After your bowel is completely cleaned out, a tube is inserted into your rectum, but no farther. Once the tube is in your rectum, your bowel is filled with air. The tube is withdrawn, the air stays in your bowel, and then you have a specialized CAT scan that looks at your entire large intestine and examines it for polyps. Now, if a polyp is found, then you have to go and have a colonoscopy done to have that polyp removed and have it checked to make sure that it's not cancerous. An older test that was previously used quite often to detect colorectal cancer was the air contrast barium enema. Now, this is rarely done, but the procedure is a tube is placed into your rectum, a special type of contrast is placed in your large intestine, and then your large intestine is filled with air. That special contrast that was inserted into your rectum shows up on the x-ray very well. So a series of x-rays is performed, and that looks for a polyp in your colon. Similar to the virtual colonoscopy, if a polyp is seen, then you have to go through an entire bowel prep and have a colonoscopy done so that polyp can be removed. Although many people find the whole thought of colorectal cancer screening very unpleasant. However, the upside of this, preventing you from getting colorectal cancer, is well worth the effort. So if you're over 50 years old, or if you know somebody who is over 50 years of age and they haven't had colorectal cancer screening, my strong advice would be to have this testing done. This has been Dr. Tim Moser with MedRounds. Until we meet again, wishing you the best in health and prosperity. Take care.